Have you ever hurt your back deadlifting? Oddly enough, I did about a month and a half ago. And I went to stand it up and I felt something pull in my back. I didn't finish the rep. I immediately dropped the bar. I, as a physical therapist, know that the majority of deadlifting injuries are a disc herniation. So I immediately put away my weight. I wasn't starting to spasm. I wasn't getting fire down my legs, nothing crazy yet. Started doing press ups. You lay on your stomach, you immediately start pressing yourself up, leaving your hips on the ground like you're doing a push up. That is an exercise that we prescribe specifically for people if they are dealing with a disc herniation. I did 2 sets of 10. That told me I was likely dealing with a disc herniation because I felt better afterwards. The rest of the workout, I did less weight than I was expecting. So I did not do the RX weight like I was planning to, and I scaled the movements in the actual WOD so that way I felt like I could complete it without overdoing it on my back, since I felt like I just hurt myself. Afterwards, I felt great. I had no worse pain. I was sore the next 3 days later, and the day after especially, I was super sore. I probably did 100 press ups that day. A lot of my work, I do sitting and then I do some computer work. Bending forward doesn't feel very good on a disc herniation. It actually makes the pain worse. So every time a new patient came in, I got on the ground, I did a couple sets of 10. I let my patient know what I was doing because they were like, what's all that? Some of my patients who have a disc herniation, they were like, oh, you too, huh? So the reason I'm telling this story is that if you hurt your back deadlifting, the most common injury you will be getting is a disc herniation. I don't care if you feel it in your hamstring. I don't care if you feel it in your calf. I don't care if it feels like your knee hurts. I don't care if it feels like it's in your hip. It is likely a disc herniation. That is not a guarantee. It is just very likely. So if you hurt your back while you're deadlifting, immediately put your weight away, start doing press ups and do a little test. Do I feel better after that? Yep, sure do. Probably a disc herniation. I can say I likely did not have a terrible back injury from that deadlifting injury because I immediately, like within a minute of the injury, started doing press ups. Basically what that did is it removed the disc herniation so that way inflammation, like a lot of inflammation, could not set in, which means my back didn't start to seize up and I didn't start getting spasms. My back didn't get stiff and tight to the point where I couldn't move. And then I was able to complete my workout because motion is lotion, so it felt really good afterwards. And it was actually a really good thing for me. So I tell this to patients all the time, but I'm even more exaggerated about it now. If you hurt your back or you get a flare up and you know it's a disc herniation, or we've been working together and you know it's a disc herniation, immediately start doing your press ups. Immediately. Save yourself from weeks and weeks and weeks and weeks, months maybe, even years of pain because of this disc herniation. Start right away. I did mine right away. Within a week, I felt awesome. I had no issue. I had full back range of motion. I was fully deadlifting again with no pain. I felt great. So try this if you ever hurt your back deadlifting. Save it if you know that it's happened to you before. Keep this and use it.